Today, your dentist has many options available to repair damaged and decayed teeth. But as natural as these cosmetic restorations can look, they all start with a good foundation, and that often starts with a root canal. A root canal is a very common dental procedure used to avoid extraction of an infected tooth. It is always the goal of your dentist to preserve your natural teeth whenever possible. Despite what you may have heard, a root canal is actually a relatively pain-free procedure. Many patients find a root canal to be no more uncomfortable than having a tooth filled. The purpose of a root canal is to stop the bacteria that have progressed into the root of a tooth. Left untreated, the infection will worsen and can lead to a painful abscess and ultimately the loss of that tooth. To understand a root canal procedure, first we must learn a little bit about the anatomy of a tooth. Teeth are made up of a hard outer shell, but the insides are actually soft tissue consisting of the nerve and pulp. When this interior tissue becomes infected due to bacteria from tooth decay, the nerve tissues begin to break down, creating a hollow space that is a haven for bacteria. Antibiotics or the body's own natural defenses cannot get to these bacteria, making extraction or root canal the only option. In a root canal procedure, the dentist removes the bacteria along with the nerve, effectively sterilizing the tooth. Removal of the nerve does not affect the structure or the normal day-to-day function of the tooth. Depending on the severity of the infection, a root canal procedure itself can usually be performed in a single office visit. Based on the condition of the tooth after the procedure, subsequent visits may be required for a cap or crown. Root canals can be completed by root canal specialists called endodontists, as well as by general dentists. Of course, the first step in the procedure is to make sure the area is completely numb using a local anesthetic. The dentist will use his drill to gain access to the roots and pulp. The dentist then inserts tiny root canal files of increasing diameter through the egress hole to clean out debris, bacteria, and pulp tissue from the root canals. Once the nerve area is cleaned out, a special sealer is used that will keep the area sterile and make it very unlikely that any reinfection can occur. Once the root canal has been completed, sometimes the tooth can be closed with an ordinary filling. However, most often a cap or crown is recommended, as these can make the tooth that has been canaled stronger. When done properly, root canals are successful over 90% of the time in preserving your tooth, alleviating pain, and restoring your smile. If you believe one or more of your teeth may be in need of a root canal, please contact your dental professional today.